I'm June Gruber, an associate professor of psychology at the University of Colorado Boulder and director of this mental health expert series. I'm excited to be here today with Dr. Erin Fisher, an associate professor of psychology at the University of California, Berkeley. So thanks for being here today.
No problem. Thanks.
I was wondering, Erin, if you could start by just telling us a little bit about the kind of mental health work and research you do.
Yeah. So everything that we do in my lab is couched in the framework of idiographic science, which is basically the idea that we should be studying individuals one at a time. A major misconception of what we do is that we're not interested in groups or generalizable features or things like that. And that's, not the case. We're super interested in generalizable rules and laws and conclusions and phenomena. We just come from the approach that, and a few other folks in the field do as well, that the way to get to generalizable conclusions is actually through the individual, as opposed to starting from, collecting large samples and aggregating and stuff like that. In terms of content, I came out of Michelle Newman's lab at Penn State, worked with Tom Borkovic and Louis Castonguay, and did a lot of generalized anxiety disorder research, worry research, and some RCT research. And so when I started, the kind of focus area was definitely around anxiety and depression. But at this point, we've got folks in the lab working on PTSD, substance abuse, kind of emotion science and affective science generally. So we've got a few focal areas that we cover.
And Erin, how did you first go about getting started in this work?
So taking Peter Molinar's person-specific data analysis class in the fall of my 4th year of graduate school. So yeah, I'd never heard of idiographic science. I didn't know about person-specific anything. I didn't know that it was possible. And, I kind of had a quasi-religious experience taking Peter's class where I would literally sit there and ask him questions. I would raise my hand and say, why doesn't everyone do this? Like, why isn't everything done this way? Especially for someone who's in, clinical science and clinical psychology. It just really struck me as how everything should be done, because we are often treating, of course, the individual and concerned about the individual. So that was the beginning of it. I actually thought I was going to have a career based around psychophysiology. I didn't know really what to do, how to get the right data, because you have to get lots of observations on each person. And when I was finishing grad school, it was still early enough in the smartphone game that didn't necessarily present itself as a plausible way to get data. So so that's how it started, Peter's class, and then it kind of built as something that I just realized I was so passionate about that I had to kind of figure out how to get the right data. And then technology just caught up with me and just made everything so accessible.
So when you first started and kind of following your passions over time, what has stood out to you along the way in terms of notable challenges, as well as successes, of course, that you've been able to savor?
Yeah, I mean, full disclosure to anyone watching, I got to see these questions beforehand. And when I read that, I was like, well, man, I could speak for 3 hours about all the failures and challenges. I mean, there's been a bunch. There's been the challenges of being able to get grants to get funded and things like that. I think the principal challenge has been that people have ended up feeling threatened by how I'm trying to do what I'm doing, because I do think there's an inherent component to it where you say, oh, we should do it this way, that people very much hear that we shouldn't do it the other way. And of course, collecting large samples and using that as the basis for research is how just about all psychological research is done. So that's been tough for me to navigate, because I'm not interpersonally and socially and all that, I'm not all that facile, and I can come off, I think, as my passion, I think, can come off as maybe a pushiness or a pointedness or something. And so that's been tricky sometimes at conferences, sometimes in dealing with reviews, just trying to navigate a space where you're advocating for something and you want to advocate in a full-throated way, but you don't want to be contentious or antagonistic. And that's definitely been my number one challenge, without a doubt. And then there's been technical challenges, like I said, a moment ago, you have to get as much data per person as you would for your large samples. So whatever analysis you want to do, if it needed an N of 100 or an N of 200 or, whatever you were shooting for, you need to get that many observations per person. So you need to have the technology to do it. You need to be able to streamline your measures so that you can bother people 4, 5, 6, 7, 8 times a day, day after day, and they don't get tired of it. So there's all those challenges as well. So anyway, yeah, like I said, I could go on for hours about challenges and failures and frustrations and all that. Yeah.
And what about successes? I mean, it's really remarkable, as you're saying, the amount of work it takes to do the work you do within each person to really understand who they are.
And I mean, I'm one of these classic people in academia, very neurotic, constantly convinced that I've pulled the wool over everybody's eyes, so I just feel, I mean, I mean it sincerely. I feel so lucky that I, got into grad school, got the postdoc I got the job I mean, everything has felt just really fortunate. I mean, so the number one success is just having an opportunity to have a place at the table, honestly. But other than that, I guess it's been that this was a gamble. Just a quick little anecdote. Rich Ivory was the chair at Berkeley when I got hired, and he took me out to breakfast the second day of my interview visit. And he said, people were really impressed with my job talk, but they all felt like giving me the offer was like playing roulette. That it was a big gamble, that it might pay off, but it also could all blow up. And I think that was a really fair comment. I actually said that to him at the time. And so I think the biggest success and the thing I'm most thankful for is it was a bit of a gamble to set up a lab and do research this way, and just that it's viable and that it seems to work, and grad students are coming to the lab and they're getting pubs, and we just sent our first 2 out to internship and they're doing very well. I mean, just the fact that it seems to be working and it was a bit of a gamble, I think I feel really grateful for, just that's pretty exciting. Yeah.
So, I mean, along these lines, where do you see the most kind of important steps in the future of the field going?
Yeah. Well, I mean, I published a paper 2 years ago in PNAS, the Proceedings of the National Academy of Sciences, where we talked about, kind of had a very serious title, that the lack of group to individual generalizability is a threat to human subjects research. And aside from the severe title, the paper's just trying to make the point that we shouldn't assume that we can understand individuals from groups, and we shouldn't understand that we can understand groups from individuals. And anytime there's anything on the line, when there's any important issues, which of course in clinical science, pretty much everything is that, we should be looking. And there is more, all of a sudden, you see more of this research going on. Aidan Wright is doing it at Pitt. Tom Rodabaugh's lab has started doing it at WashU. I can't remember the name of the researcher, and apologies if you're watching this, but somebody just got hired at University of Washington to set up a person-specific lab. So more and more of this work is happening, and that's really exciting. And so I just think the next step is for people to add this to their arsenal, an idiographic perspective, that it doesn't have to be niche or belong in just one lab. And we're actually trying to do that and trying to find ways to do a little bit more group level stuff, finding places where that's more appropriate and doing some compare and contrast and things. I just think that it would be really great if the field kind of just was trying to find the right perspective, the right angles, the right, units of measurement, and going about it in that way, as opposed to kind of setting up, camps and operating out of camps, would be really exciting, I think.
And my last question for you is just thinking, kind of stepping back, what advice you might have for people who could be watching this interview today, maybe it's students or the public, and want to learn more or get engaged in the field?
Yeah, it's so tough because, I think it's 2020, and I think so many of us are being confronted with how much luck has played a role in our lives, and how much privilege, of course, has played a role in our lives. And I grew up in a wealthy suburb. I've gone to great schools. I've had, I've had setbacks and difficulties and everything like that, but I've had a tremendous amount of good fortune and privilege, and I feel incredibly lucky. And that's, I think, important to say just anytime you're talking about your successes or your path. But it's especially important as a preface to my answer, because my answer is all about like the fact that I've always just kind of followed my passions, with the assumption it'll work out okay. I majored in music as an undergrad. I had a career as a performing musician for several years. A lot of people have heard this story from me. I wanted to propose to my wife. I needed something more stable. I kind of randomly picked psychology. I went to a post-bac program and and then discovered I really loved it and was passionate about it. And that was a happy accident. But pursuing the ideographic stuff, like all of these kind of different choices I've made throughout my life, it's not that I don't try to be rational and deliberate and all that kind of stuff, but I very often kind of go with what I feel and what I love and what gets me out of bed in the morning kind of idea. And that's always been a very appealing idea to me. And I just kind of follow that doggedly. And so I guess, that's my advice, right? Is to try not to pick a subject matter or a field of study or something that you think is in vogue or that you think will get you the grant or get you the job, but instead try to find the things that you're really passionate about and really speak to you. But what I'm realizing is maybe I also should weigh that against acknowledging that I've probably had a lot of doors open for me and opportunities that, maybe if somebody out there tries to just follow their passion, they might not have that same degree of success. So I've been very fortunate to kind of follow a very idiosyncratic path in my life and have things work out very well. So, yeah.
Well, thank you so much. I mean, and it is inspiring to hear, just how you followed your passions along the way and, also taken risks while, appreciating the privileges we have when we have them. So I really appreciate you sharing that and for just taking the time to speak today.
No problem.